Good morning, everyone, and welcome to the White House Conference on Hunger, Nutrition, and Health. The purpose of this discussion is to share our work, our ideas, strategies that we have been working towards the same goal, which is ending hunger and making health accessible for all. All the findings during this session will be shared with government officials of the White House who are collecting your stories, ideas, experiences with hunger and diet-related disease to directly inform a national strategy to end hunger for good by 2030, which will be released at a conference this fall at the White House. So, do we have personal stories to share? Does our community have local solutions to uplift? Do you have ideas about the government can take about bold action? Those are some of the questions that we're going to be addressing in today's conference. So today our panel is collected with great leaders from the region, San Bernardino and Riverside. So I would like for each of us to introduce ourselves and our titles.
Good morning. Thank you for having me. Senator Connie Leyva, representing the 20th Senate District.
Good morning. My name is Dr. Yen Ang. I'm representing the Tangelo. I'm the Vice President of Health for Tangelo. I'm very excited to be here to share with you some solutions with regards to ending hunger.
My name is Lorena, Valenzuela, and I'm representing the community that it benefits from the bank food.
Good morning. My name is Alejandro Barajas. I am the Community Engagement Manager for Blue Shield of California. I'd like to thank Unidos for inviting us to be here, and all our panelists who are amazing champions in the community for food insecurity combat. Thank you.
Hi, everybody. My name is Omar Gonzalez Valentino. I am the Director of Behavioral Health with True Evolution. We are a nonprofit in Riverside.
Beautiful. Thank you, everybody. So today's conference is going to be guided by the pillars of improved food access and affordability, integrate nutrition and health, empower all consumers to make and have access to healthy choices, support physical activities for all, and enhance nutrition and food security for research. As I mentioned earlier, all these findings are going to be shared with the White House folks who are trying to gather our ideas, strategies that we can all collectively input into finding a solution, which is ending hunger. So we're gonna get right to it, and please feel free to interact as we go along. I'm gonna ask questions, but again, this is an open discussion. So feel free to raise your hand if you don't have a mic, and we can give you a mic, and then we can make it all happen, okay? So we're gonna get started with Ms. Senator Connie Leyva. You have been our Senate for District 20th. Can you share with us some of the initiatives your office has undertaken in order to end hunger?
Absolutely. Thank you again for having me. I think that it is unconscionable that we have people in the richest nation in the world that are hungry, and many of those people who are hungry are children. So we, as the chair of Senate Education, I've had the honor and opportunity of helping shepherd through legislation to make schools a place where our children can eat. But also I think it's really exciting that we have changed how we look at food and food consumption. When I ran my local union, we had a food pantry, and we were always concerned about, we had carbs mostly, and, we had beans, and we had rice, and we had things that would fill people up. And I think we've done an excellent job in this region, and I hope the country, in moving to plant-based foods and in community gardens. One that we have worked with on Team Leyva is Huerta de Valle, which is in Ontario. They have done an amazing job with their garden. We just secured $1.7 million for them so that they can build an educational center. And the woman who runs this garden says, I want to make sure my people, it's mostly a Latino community, know how to eat and know what's good for them. And what I have told her is this is generational. You are changing people's lives and generations of people to come. So we have worked with them. During the pandemic, we partnered with a rice company in Northern California to bring 4,000 pounds of rice to the Inland Empire and our food pantries. But we've really, I could go on, but I know we have lots of people here to talk about what they've done. But I think what is really key key is community gardens. How do we grow foods in neighborhoods so that way the families and children, when you learn things as a child, you will carry it through your life.
Right, and they're sustainable as well, right?
Totally sustainable.
Once
yes.
leaders like yourself come in to pour funding, but what can they do moving past the point? How can the community get involved? How can other local city officials get involved? Because at the end of the day, we have to keep it going, and everybody has to get involved. Otherwise, that project can die.
Absolutely. It takes buy-in. So you have to have people that buy in, people who actually realize that there is a problem with hunger, because believe it or not, there are some people who don't realize that. And then you can do a community garden anywhere. I live in the city of Chino, and I've seen them sprouting up on different corners. The city itself has built a community garden, and get people excited about it. But you have to have that buy-in from city officials, elected officials, and if you lead, people will follow.
Right. So I have a question for you. How can the government improve food access and affordability, especially in rural areas, tribe communities, for example, expand eligibility for and increase participation in food assistance programs, and improve transportation to places where the food is available?
Well, we first need to recognize that we have food deserts coming out of the grocery industry. We did a lot when I was with United Food Commercial Workers. We did a lot to identify areas where there were no places for people to shop. There were literally food deserts. And I think we need to do the same thing. We first need to identify those areas, and then we need to figure out, how do we get there? How do we find the funding? We, in the 2022 budget for California, we've increased $5 million ongoing from the general fund to expand the number of library jurisdictions, which can help provide summer meal programs for low-income students. And I really think that we just have to be as creative as possible. Something else I think that we can do is where people aren't always aware of what's available to them. So how do we make sure that they're available? Do pediatrician offices, do community clinic offices, do they know, are they telling their clients, their patients, where they can find food? The SNAP program, the EBT program. So a lot of it is awareness. There are a lot of good programs, but we need to make sure we can connect them with CalFresh and the EBT program, and that happens from awareness. And as we all know, everybody on this panel knows, that's the challenge, right? How do we make sure we connect people with services? Schools, libraries, pediatricians, community health centers. I think that's how we get the word out, because there are a lot of good programs out there.
Indeed, there's a lot of programs that a lot of people don't know. Something that our nonprofit, as you all know, I'm the CEO for Unidos Por La Musica, and we run a food bank that is helping 200 plus families every week.
That's fantastic.
From different parts of the county of San Bernardino and Riverside. And so during the pandemic, our focus was obviously to get the health to everyone who was in need, but especially for the vulnerable population, seniors. And so my team was driving to remote areas of the Inland Empire. We were going to Barstow, we were going to Mecca, Indio, some places that were so far that at one point my team will call and say, hey, we lost connection with Google. So we saw doing that project that transportation was the biggest issue for a lot of families that live in these rural areas. They don't have access to the local food pantry. Perhaps maybe the closest is 20, 30 miles. So how can we collectively come up with a solution to make it more accessible for these folks? Anyone?
Yeah, let somebody else answer. I've done all the talking.
No, you're good, you're good.
Okay, I think that.
No, if you do have ideas, go ahead.
Okay, but go ahead. Well, okay, I was just going to say, we have mobile food trucks for people to buy food, but what about mobile food pantries? I don't think we see enough of that and getting to these rural areas. But we also know that people are hungry. We fed a lot of seniors during the pandemic as well on Team Leva. In the inner cities, people just can't get out. Maybe they are they're disabled, or they were afraid during the pandemic, as they should have been, to go out. So it's our job to find them. But going to the rural places, let's take the food to them. I think that that's something realistic that we could do.
And that's something that Unidos Por La Música was doing. And actually, our food bank has that mobile food pantry. So we're always looking for community partners. We are big on corporate social responsibility. So we have a great partnership with Cricket Wireless. That is a strategy that I can share with other nonprofits. So, and it's a win-win because businesses like Cricket Wireless, they want to get their name out there, right? And they want to get customers. And just because we are low-income individuals doesn't mean that we don't have spending dollars, right? So our mobile food bank does that. We go to different stores within the region with Cricket Wireless, and we help the community. And it has been a strategy that has worked for 11 years now. But we would love to see other local officials to get involved behind perhaps, providing a van that has a refrigeration, so that then we can carry fresh products to these folks in rural areas. So that's something that us at Unidos Por La Música we're doing. Dr. Jen, I know that you're currently working a project to help clients who are part of the SNAP and CalFresh programs to make better options when it comes to using their benefits. Can you please share with us what it is that you're working on, and how can this model perhaps be replicated in other regions to ensure our families buy the right food?
Well, thank you. I think before I answer your questions, the discussion just now was so vital and so crucial. I think both of you brought up a very important point about food insecurity, which is one of the factors, right, that drive out hunger and food insecurity in our county, which is the idea of accessibility, right? So healthy food has to be accessible to everyone, regardless of their socio-economic status. I'm sure all of us on the panel will agree with that. So I see food insecurity is a huge problem. I agree with you, it should not happen in America. We are such a rich and affluent country. We have so much money and so much resources. So I think the fact that it exists in our society, it only goes to show that there's some equity issues. It's not about resources. It's not about lack of food. It's about redistribution of food. So accessibility is one. So in my book, I think there are three big factors, right, that drive up the inequity or food hunger that we see in San Bernardino County. One is the big one, the first A, I call it accessibility. Food is so accessible. And number two is affordability. A lot of food may be accessible, but it's not affordable, right? It's too expensive for many of our folks in our communities. And the last one, last A, I call it triple A, is really the awareness, the lack of awareness of how to prepare food. A lot of times I've seen, right, in the last 2 years when I was working with CBO, community-based organization, distributing food during the COVID, I noticed a lot of people, when they open up the food boxes, half of the items that they see either is culturally inappropriate, they do not know how to eat because it's culturally not relevant to them, or they simply do not know what it is, right? I have had folks who come and tell me, Dr. Yen, I have this thing. I would say, okay, show me on video, on Zoom what it is. And it's actually kale. They don't know how to cook kale, right? So I think the last A is awareness. So we need to address these three big drivers: the awareness, the lack of accessibility to healthy food, and the lack of affordability. And I'm very thankful that I'm joining this private company called Tangelo. Of course, I'm biased. I'm their employee, but I think the reason I'm drawn to this social enterprise company was the idea of how we can work with government. Really, we cannot look to government for all the answers in the world. We can't, right? We have to work together with government. And it's a partnership we are trying to establish with government as well as healthcare providers, because they are the one who has direct contact, direct impact in terms of the policy on millions and millions of Americans. What we want to do is address the three big C's, right? The three big A's, the three big drivers of health inequity. So what we did is we came up with a platform, a digital platform called the Tangelo Food Benefit Program. So we work with SNAP, basically, like you say, CalFresh in California, we call it. Anybody who has SNAP dollar, who has received EBT card in terms of their debit card, they can use what the benefit they receive from CalFresh and buy healthy food on our marketplace, on our digital marketplace. So on our platform, if you get transferred onto our platform, you download this simple app, you can shop all the healthy food products. And I say healthy food because we only provide healthy food. So in that way, we help people make choices that's healthy without them knowing it. Because one of the things some of you may know is cow fresh or SNAP, as good, as amazing as it is, Senator, I love the program. It's one of the best first line of defense against hunger. Okay, we need the program. We want to make sure this program stay, right? Because every year we feed 45 million Americans. Now, as amazing and as good as it is not a diet police.
Yeah, that's exactly right.
And we don't want it to be, because we're Americans, we love freedom. So, but in Tangelo, we have a way, a very clever way to nudge the users who are on our program to healthy food choices, because as long as they are on our platform, they will not be able to buy potato chips. They will not be able to buy soda drink, for example. So the money, whatever money they receive from the government, if they transfer onto our platform, they only have healthy food choices to shop. That's number one. So we create the awareness part, the big A, the first A. The second A, we deliver food to them. So we resolve the issue of accessibility. I mean, it pains my heart when I hear you talk about food deserts. I'm very familiar with food deserts because I live here, right? I run the anti-hunger coalitions. I have members who come to me, who talk to me about their pain and their hardships that they face living in high deserts. The only nearest grocery store that is within walking distance or 1 mile radius is the gas station. So they end up using their EBT card, buying TV dinner, or this high sodium, high fat food, right? Yeah, so high processed food. So we address the second A, which is called accessibility, by making fruit free deliver to their doorstep. So whether you live in Victorville, Hesperia, or Yemet, whatever, you don't have to worry. As long as you're on our platform, we deliver food to wherever you are, right? And the third A, which is affordability, and this is a big investment that my company is prepared to make, which is we are giving anyone, any EBT card holder, a 30% additional bonus purchasing power. So for every $100 that you spend, we, as a company, we are so committed to healthy eating that we believe that you love our product so much that we're prepared to make the initial investment and say that, okay, for every $100, we're going to give you $30 additional free food. So you actually have $130 to spend when you only spend $100. So the 30% purchasing power is based on a research that my founder has been so convinced in and so passionate about. And the research basically says that is a groundbreaking research that says that if you give a population, right, that suffer chronic diseases as a whole, additional 30% of fruit and vegetables, and over a long period of time, you actually can see them reduce chronic diseases by a significant margin. And that research served as a foundation to our philosophy, our company, that believe in giving people additional 30% fruits and vegetables, 30% additional serving. So we are hoping to work with government, county government, at the county level, at the state level, even at the federal level, to work with them to co-invest with us in this 30%, so that we can continue to feed the people who need healthy food, to fight diseases, to recover from the sickness, as well as to be resilient. I mean, what does COVID taught us in the last 2 years? Right? That health is not fair, right? Health outcome is not fair. For some population, they seem to suffer the most health inequity than some of us, right? So we need to close the gap by making sure, because food is so foundational to good health, right? And that's why we are here. That's why the White House is organizing this conference, first time in 50 years, because they understand that food is so crucial, so foundational, and has so much profound impact on our health in so many levels. I can't even begin to describe how much impact it has. So it's enough of talking. We need to have solutions, right? And I'm excited on our panels here. We have solutions to offer, and we are here to work with government as well as work with healthcare agencies to provide this solution to address these 3 big A's.
Indeed, thank you, Dr. Yan. And obviously that leads to health-related issues, as you were mentioning. You know, not having access to the right food, food insecurity. I mean, the county, Inland Empire region, more than 500,000 people face food insecurity. And you know, I'm excited to be here. Like just like Dr. Yan said, you know, just to give the White House, you know, remind them that we need better programs, healthy choices, and in the past years they have pilot programs that were healthy, like USD aid. They were purchasing in a large quantity of fresh products, food, with local companies like World Trade Foods, if I'm not wrong. And so their job was to then distribute these boxes of food to nonprofits that will ended up in the community, and they were healthy choices. I remember giving boxes with protein, fruits, vegetables, but that program only lasts 6 months, and it went away. You know, with and it was through the USD aid, and it was an amazing project, amazing program. It was a grant that it was available to these companies that serve big chains like Walmart, Costco, and all of them. So we want that program back. Our local account that selected Unidos Por La Musica Food Bank, you know, say after 6 months the program ended, there is nothing else we can do for you guys. So we were, you know, disappointed, and more than anybody, our families were the one who were suffering. And so that leads to my next point with Blue Shield. We have Alejandro here representing Blue Shield as a manager for the region. How has hunger impacted the health system, and have we seen an increase in diet-related diseases when it comes to educating our communities about nutrition? What are some of the initiatives Blue Shield of California is working on here in the Inland Empire?
Well, thank you for that. I think it's been well documented that we're seeing a correlation between food insecurity and chronic diseases. What does that mean? I mean, we're seeing an increase in diabetes. We're seeing an increase in, you know, COPD, kidney disease. So many of these diseases, which, you know, impacts our community, right? That means that we see an increase in the doctor visits and hospitalization and ICU that directly impacts all of our system. So we're definitely seeing the correlation. As Blue Shield, you know, we are a nonprofit plan, and we've been leaning in on food insecurity for quite some time, and also here, you know, in the Inland Empire. I can definitely, you know, provide some examples. You know, I was very fortunate when I first got here to Blue Shield last year to partner with Dr. Yan Ang on high poverty, low access areas, and we really formed a program around getting the funds to where those food deserts are. So again, the biggest thing for us at Blue Shield is to be great listening partners. I think this is a great conversation that we're having, a great start, because it starts with listening to what the community actually needs before we try to provide a solution. Because I think sometimes organizations come in and say, we have the solution, and I don't think that's the correct approach. So I appreciate you know, partners like Dr. Yan Ang that stepped up and said, hey, I'm also passionate about this. Let's combat food insecurity together. I hope that answered your question.
It did. Thank you, Alex. Omar, what are some of the initiatives that True Evolution is implementing to prioritize the role of nutrition and food insecurity and overall health among the LGBT plus communities in the Riverside County? Because obviously hunger affects everyone, not just one community in a specific.
Well, you know, True Evolution is an amazing organization, and we fight for health equity and racial justice for LGBTQ plus people in the Inland Empire and beyond. And one of the things that we really focus on is not necessarily the symptoms, but the root causes. And so what we really try to do with our current programming, we have community health programs working with case management. We have our mental health clinic that is helping folks work through their interpersonal challenges. But we also have a new project called Project Legacy, which is something that we're very much proud of. It's in the heart of downtown Riverside, and we have 6 buildings, 5 residential and 1 5,000 square foot commercial building that's actually going to serve as our headquarters. And this program is really designed to tackle hunger from that root cause, really focus on housing individuals, making sure that they have a healthy space so that they can have access to the food. We can provide that, provide them case management, provide them life skills, provide everything in-house, one-stop shop in a beautiful setting so that folks can really know that they're valued and that they can access these things. You know, a lot of times I think folks that don't have access start to lose the realization that they should. And we are really making sure that folks value themselves, and we're going to teach that. We have different wellness programs that are going to augment not just the roof over their head and the food that we give them, which are going to be healthy options anyway, but we're going to have community garden space. We're going to have space that folks can go and be calm and relaxed. That's going to help reduce their health challenges as well. And we're also going to make sure that they have linkage to care, both from a physical health side, mental health side. You know, as we go along with these programs, one of the things that we're trying to do is actually replicate this across counties, because Riverside is one of those metropolitan centers in our area, and great, you know, we've got funding, we've got the ability to do so, but we need to be able to expand this to the San Bernardino counties as well, other surrounding counties that don't have as much access or as many resources, you know, going to the edges of the county that don't have, that have the challenges of food deserts even worse than those high metropolitan areas. You know, True Evolution is really an innovator because we're really trying to be nimble and flexible and cross-cutting in our approach. Oftentimes there's this siloing effect of different programs because the problem is so great that it's difficult to kind of eat the elephant whole, right? So what True Evolution is trying to do at different scales is actually make sure that folks can do it all in one place. Now, it's not as wide swaths that we can reach, but for those folks that come into our place, they feel like home. Just one small story that I'd love to share is the fact that, you know, we have community peer-led support groups that we do. Part of the basic functions of those support groups is actually feeding folks. We have a food budget for every group that occurs, and folks sometimes rely on that weekly group to be able to get their meal for the day. And so that's something that's very much important, from the chief operating officer down to the group facilitators that are volunteering their time. Having access and giving food freely to the folks that are coming. You don't have to pay into that program. There's no, you know, there's no extra funding that's coming through. That's just something that True Evolution knows is important. People need to be fed heart, mind, and soul.
Indeed, and it starts with education. I hear across our panels that it's all about educating our community, what's available to them and how they can access to that. Are there any challenges that you guys are facing, or something that you would like to see change or help with by your local Congress, Senate, city officials? Are you guys facing any obstacles?
You know, one of the biggest obstacles, you know, being in an LGBTQ oriented organization, there's obstacles in terms of prejudice. There's folks that don't want to see the community thrive and succeed. There are things that really drive folks to just not see the person behind a diagnosis like HIV or a label like LGBT. And I think the communities that we live in don't necessarily embrace that fully, and sometimes actively work against that. But on the same coin, there's so many folks that are willing to to sacrifice and give up their time and energy to do so. In terms of local, state officials, I think the biggest challenges is just securing the funding, making sure that we have the resources to be able to make these programs happen, and to be able to convince folks that this is actually important. I think that's always the challenge, is making sure that folks can really see these communities as kind of builders and framers of this society that we want to have. You know, that's the pursuit, right? So basic funding structures, making sure that we can get through, you know, the legal challenges of maintaining insurances and making sure that everything's going. You know, we almost pay, I don't know the exact number, but the number's in millions in terms of insurances. And that's just to comply with state and local regulations. That's not even the building of the buildings. So it's, you know, it can be challenging to make sure that the funding is kept up and that we're still pushing the mission forward, and that it's always about the consumer, the end client, the end user, the person. Because we can look at numbers, we can look at metrics, we can do all these things, but at the end of the day, these programs that we run, there's people that are directly impacted, and they all have unique stories and unique lives. And once we zoom out too far, sometimes we lose a little bit of that. And so just trying to bring that face to these programs, I think, is something that we really want to try and keep doing.
Well, congratulations, and I'm excited for the grand opening. You know, I'm excited to see the center, the LGBT in place in Riverside, because, like you say, you know, LGBT community, it's our community, our friends, our family, our brothers, our sisters. So we need to embrace that, and they're here. They're good citizens. They need help, and hunger doesn't discriminate. Whether you're Mexican, white, Hindu, black, white, whatever the case is, it doesn't discriminate. Today in our panel, we have one of our recipients at the food bank, Lorena. And we met Lorena a couple years ago, and she has come to our food bank a few times. Just like anybody, life happens. You know, there's times where, you know, she was not working or underemployed. And so I think it was vital to really hear her story from the end recipient. So Lorena, ¿quiere compartir con nosotros su experiencia cuando va al banco de comida de Unidos por la Música? Would you like to share your experience going to your food bank?
Pues mi experiencia ha sido muy buena, ya que con la ayuda en los bancos de comida y en estos momentos difíciles que muchas de nuestras familias, y en mi caso también, que lo hemos necesitado, hemos perdido nuestro trabajo, y al recibir esas cajas a veces es el único alimento que tenemos para darle a las familias. Lo que sí es que la mayoría de las veces recibimos en esas cajas bastantes latas de comida. Entonces nosotros como comunidad latina utilizamos más productos frescos que nos ayudan pues para mejorar nuestra salud, ya que comunidad latina tenemos mucho índice de diabetes, presión arterial. Entonces al consumir más productos frescos pues nos ayudan para mejorar nuestra salud.
So Lorena was just sharing that, you know, indeed she's grateful to come to her food bank. You know, being unemployed, she knows all the struggles. But when she has come to our food bank at Unidos Por La Música, she has received a lot of canned goods. And she says, you know, as, you know, because of my culture, we don't eat canned goods all the time. You know, she's Mexican, so I'm Mexican as well. So as Mexicans, we grew up with, you know, the belief that canned goods are not good for you. So, you know, and she was sharing that, you know, luckily for her, you know, her family doesn't suffer of any diabetes, stuff like that. But what happens when your family does have, you know, high blood pressure or diabetes, and when you go to the food bank, all you get is canned goods? And, you know, and when I heard Lorena's feedback to our food bank, you know, obviously it's stressful for me and for my team, because we want to give the best. We want to give fresh products, dairy, protein, all of that. But us ourselves as a food bank, we also face challenges. and not always, get the best for the community. As I mentioned earlier, last year we were working with the USDA program that we were receiving these boxes, but then that stops, and then so now we go back to what funding do we have available and what resources do we have available, and it's heartbreaking to hear that sometimes family do come to the food bank, but at the end of the day, they were not helped. Dr. Jen, you had a question or a comment?
So, I think we need to really address or look at hunger as a systemic issue, right? It's more than just empty stomach. It reflects poverty, right? It reflects inequity that we have in our society as a whole. And so to address hunger, we really need to look at very upstream. I call it very upstream, the root causes. I know one of you mentioned that, the root causes that contribute to food insecurity. And really, I always wonder, giving a bag of food, giving a box of food to a family is good, right? Because we are helping the family, providing them immediate relief from hunger. But what happens when the bag is empty? What happened tomorrow? What happened next week? What happened next month? So we need a sustainable solution, right? And we know in America we have a food assistance program called the SNAP program. But we also know, as good as it is, like I said, it's not perfect. It's not perfect. That's number one. Number two, we must not forget that SNAP has a lot of restrictions that come with it. One of them is income-based. So if you earn certain amount of money, if you exceed by just $1, you are not qualified. But then you are still needing the food. You still need to feed your family. So what do? So this family will turn to food bank. And like I said, is food bank good? Good. But then you will end up getting canned food that you don't like culturally, or food you do not know how to eat. So really need to look at some of this assistance program to see how we can improve it. One of the ways I really look at is to revamp our SNAP. We really need to look at it, right? Politicians need to come together in a bipartisan manner to look at it and say how we can make SNAP more available for everybody who needs it. Make it a little bit less stringent in terms of its requirement. Make it less bureaucracy, for example. I have known people who come to me and say, I love to apply for SNAP, but I do not know how. I don't know how to use the system, and they ask too many things. I don't have all this documentation, or they're afraid that they may get deported. There's a lot of misconception. So if we can make SNAP, for example, that's one way to make it easier, more user-friendly, less red tape, make it more available, make the safety net wider so they can capture more people and capture what I call the working poor. Yes. The working poor. People who are earning 50,000, do you know the research actually, one research findings actually show that people who are earning between 50,000 to 90,000 a year, they also suffer for food insecurity. 50% of them. So I would think that 60,000 a year is pretty good income. But depending on how many children you are feeding, right? How many kids, how many people in the household, right? And also where you really live, right? Whether you live in California or you live in Mississippi or what. So we need to look at working poor. How do we help this working poor, regardless of their colors? We need to address it. So SNAP obviously is not addressing this. So is there any way, from a politician point of view, from a lawmaker point of view, can we expand that? And number two, how can we work with private entities? Because really, I truly believe we cannot look to government for all the answers in the world, because government is not a savior. But we need them. We need them to join hands together with private sectors like us, to work together with healthcare even, to work together to come with the better solutions for all people who need it.
Thank you. Let me first just say how wonderful it is to be here with all of you with so much heart and passion to do what we need to do to feed people. I go back to the first thing you said, Dr. Yin, about giving people a box with food in it and they may not know how to cook it. Well, when we give that out, why not a little recipe? It's an extra step, but we don't want the food to be thrown away because someone doesn't know what to do with kale or something else. But I really want to get to the working poor. When we talk about root causes and we talk about why people are living in poverty and they don't have access to food, it comes down to the job that they have. We raised the minimum wage to $15 an hour in California. My first year in the Senate, it was the first thing I worked on, but $15 an hour is still a poverty wage. What if corporations who love to give stuff away like Walmart and act like the hero, what if they actually paid a living wage? What if the people who work there could actually afford to go buy the food that they needed for their family? And I hear, when you talk about Oscar, it's always nonprofits, right? Why is it the nonprofits that are always doing the work? Why aren't we putting more pressure on corporations who, especially in California, just made money hand over fist during the pandemic, while we are all doing what we can do to feed the people who lost their job, to feed the seniors, to feed our children? Our schools were doing what they needed to do because kids weren't in school and they could go and pick up meals there. Why aren't we demanding that corporations contribute to the USDA program so that instead of it being a 6-month program, it is an ongoing program? We always need ongoing funding, right? That's what people always ask me for as a senator. And I'm like, one-time funding is really easy. Ongoing funding is always harder. But I think that in America and in California, we do not demand enough of our corporations. We let them get away with corporate welfare. When I was with the United Food and Commercial Workers Union, we saw, and I'm sorry, I know people like Walmart, I'm not a fan, I think they can do better. We saw them hire people and teach them how to go on welfare, how to collect food stamps. We should not be allowing corporations to do that. I'm a fan of both of those programs for people who need it, not for corporations. We need to do a better job of holding their feet to the fire. They're getting all of our money. Don't even get me started on Amazon. But why can't they help make sure that people in our communities, why is it always the nonprofits? Government is definitely part of the solution, which is one of the reasons I ran for office, but it shouldn't be the only solution. So let's demand a little more. Let's make sure people have living wages. Let's make sure our grocery store chains build grocery stores in food deserts. We argued with them for many years, and for whatever reason, it didn't pencil out or whatnot. Well, what is your job? Yes, you want to make money, but don't you want to make sure people are fed? Don't you want to make sure people can eat? Where there's a will, there's a way. We need a little more will.
Omar, you wanted to say something?
Yes, so I think when we look at these problems systemically, right, we tackle this issue of hunger. It's a wicked problem, right? There's no one solution, and every solution is going to have an impact on something else, and that impact might not be felt for 10 years or more. And it's so difficult because we want to help people now. Dr. Yen, one of the things that you were saying was I really aligned with, kind of screening people in versus screening people out for these programs, and I think that's something that all of us can probably do better. I think when we get really process and rational based systems, right, we look at the rules for the sake of rules versus the rules for the sake of helping. And I think that's one way that we can start to help that systemic issue. When we talk about the corporations as well, we also have looked at tax codes and different pieces of kind of the overall functioning of our society. One of the things that I think is really important too is just how much do we value humans? How much do we value people? It's pretty easy to look at somebody on the street and just go on your way. We become desensitized. We throw away people's lives, and again, it's that face. But when you're looking at such a wicked problem, it's overwhelming and numbing. But maybe as leaders and as folks, we demand more of ourselves. We demand more of our colleagues and our teammates. But we also demand more of just how we view folks, how we value the people that we're helping and the folks that are in need.
I totally agree. And the tax codes, that is something that we can look at for corporations. I mean, we can look at it at the state level, the federal level, for good actors. We did this years ago before I even got to the Senate, and the film industry was shipping everything out of the country, or excuse me, out of the state. Well, they get the tax credit after they actually provide the jobs, rather than giving it to them up front, then they don't do what they're supposed to do. So there are so many things. I agree, it's multifaceted, and I think sometimes people worry about holding corporations more accountable because they think that it's going to cost us more money. No, what we're saying, cut into your profits. How many billions and billions of dollars do you need? Mr. CEO, how many houses do you actually need? Don't raise the prices on all of us. Cut into your profits. The people who are making the profits for you shouldn't be hungry, shouldn't be starving.
Indeed, and I think it goes more than just writing a check from corporations, because the easiest thing to do is let me write a check and let me give it to Feeding America, which is another I'm not a fan because I feel corporates need to give work with multiple organizations, nonprofits, not just one, which is Feeding America. And I think they're the ones who are holding resources from getting to where they need to be. Our local Feeding America, in my opinion, did poorly when it came to the pandemic. And I think, I don't know if it's monopoly or corporations don't see it, or they just want the easy way out, kind of, I don't want to get involved, I'm just in your community to do business. No, get involved. Don't just hand out the funding to a nonprofit that is holding back the resources from getting to where it needs to get. So that could be a strategy. That could be an idea for government to really look into that and work with other nonprofits, not just one. And that goes with corporations. Instead of Walmart donating just to feeding and Amazon, Costco, all of that, they can look into other options. Anyone else?
I want to mention a little bit about funding at the grant application. A lot of those small size mom and pop style kind of non-profit who are really amazing, who are doing amazing work every day, right? Meeting the people on the ground. They are in the trenches. They don't have the luxury of hiring one person to handle grant application. Okay, they are everybody. They are the CEO, they are the front desk receptionist, they are the whatever, the person who distribute food, they are the storekeeper, they are everything. So I have had experiences working with this amazing people at a very grassroots level. And every time, whenever I have opportunity to share with them about grant and ask them to apply, they will come to me and say, Dr. Yin, I can't. I don't know how. And actually, I have had experience of getting them to come to my office and say, why don't you come? I get my staff to walk you through, to help you translate and help you fill out the form. They actually need that. People helping them to fill out the form. But these are the people who are hands and legs. These are the people who feed people. Then we need them. So one of the ideas I have is why the government or the agencies that provide these grants, they should make certain categories of grant easier and more accessible and more user-friendly. Of course, there are some big grants like GASNIC, which is, I think it's very complex, right? Not everybody, it's very competitive even. But that is not the only grant we have. I think we should make, you talk about corporations, those big giant corporations who are wealthy like Amazon, we should get them to come up with grants. Ask them to set aside their profits for grant for the people. Easy, 10,000, 20,000, things like that. They make it so easier for the mom and pop, our neighborhood, our uncle and aunties that we see that operates all these corner store, to help them apply so that they can feed more people and help more people on the ground.
Indeed. Well, I want to say, you have a follow-up?
I also am not a fan of Feeding America, because what I've seen it do in our communities is crowd out the nonprofits who are providing culturally relevant food to people. Some of the nonprofits that we have worked with, they know their clientele and they want to make sure that they're giving them the food that works for them and their family. Feeding America is corporate, and I think people think they're doing the job by writing a check. Don't write a check. Let's fix the problem. Let's get to the root of the cause. And for me, it's always going to be a good job. If you have a good job, I used to say it fixes a lot of what ails us in society. I now say a good job fixes everything that ails us in society, and especially a job that comes with health care and a job that comes with a pension. Because I tell young people, you're going to be old one day and you're still going to want to eat. That's what the pension is for. So we have a lot of work to do, but I'm inspired by all of you. Thank you.
I just want to say thank you, everyone, for your time, for your passion, for the work that we are doing in our communities. I look forward to collaborating with you guys in the near future. Before we end the session, is anything else that you guys would like to say to our White House?
Yes, I'd like to say something. I'm a student of leadership, and one thing that I've learned over the years is that leadership is the difference. When we can truly lead from the front, and when we can understand the people that we serve, when we can understand the complexity and the adaptive systems that are working to kind of keep these institutions in place, we need to be able to unfreeze that. And that takes a concerted effort of leadership. And that's hard leadership. That's not the leadership that comes easy. That's not always the leadership that actually lets people stay in those leadership roles, because it's not very popular. You're going to make some frenemies along the way. So one thing that I would call the White House too is be brave. Really do what's in your heart. Really make sure that we can value the life that we have here. And that takes leadership from all of you.
Thank you, everybody.
I would agree 100%. As an elected official, as a leader, I always say, don't worry about being liked, worry about being respected, and do the hard work. I thank the White House for doing this, and I'm assuming all over the country, and I hope that we've provided some solutions today, and I would say call on any of us. We all stand ready to help.
Thank you so much, everyone. We're going to take pictures, and that will conclude our forum for today. Thank you so much. Si se puede, just you can.